Hi, this is Bruce Mast. I'm the Chief of Plastic and Reconstructive Surgery at the University of Florida. I'm the Maurice Ukayowicz Professor of Plastic Surgery, and I'm the Associate Dean for Regional Programs for the College of Medicine. You are listening to Interview with the Surgeon Agent.
Hello, everyone, and thank you for joining Interview with the Surgeon. Today, we welcome Dr. Bruce Mast, Chief of Plastic and Reconstructive Surgery at University of Florida. Doc, how are we doing today?
Good. How are you?
I'm doing great. Thank you for being with us. So getting started, what were your goals and aspirations during your residency, and how those changed throughout your fellowship?
Well, during my residency, I did the classic old-fashioned training of general surgery first, and then plastic surgery. So my first goals and aspirations of residency were to learn how to be a surgeon, and then and as general surgery was going on, I kind of tried to figure out what I wanted to do. At first, I wanted to be a pediatric surgeon, and then I changed gears and went into plastic surgery. And so, as I was finishing up my residency in general surgery, my goals and aspirations were to prepare myself as best I can for a full plastic and reconstructive surgical residency afterwards, or fellowship. And then once I went into that, it was my goals and aspirations were to finish that training, to be as good as I can be, get as much experience as I can, and start an academic practice.
So kind of taking us through that fellowship year, what was your mentality getting into your first job search, and how that perspective changed the beginning years of your career?
Well, my first job search was pretty focused in the fact that I wanted to do academic medicine. So I looked mostly, almost entirely at true academic jobs at academic medical centers, with a couple others that were a little bit more community-based. So my perspective was to find a position where it was a place I wanted to live, a place that provided the type of work I wanted to do, where I thought my training would be best suited, and where the best fit would be. It also complicated that was the fact that my wife is a physician, or is a physician, and you have to find a position for both you and your spouse, and sometimes that's a little difficult to do with two subspecialists.
So throughout your career, were you always focused on the academic route, or did you ever consider going private practice?
Well, when I started, it was entirely academics, and that's what I viewed myself. But actually, after 5 years at the University of Florida, I left academics and went into private practice, and spent the next 10 and a half years in private practice before going back into academics. And it was probably the hardest decision I had to make at that time, because I had totally visualized my career as that of an academic plastic surgeon. And there were many reasons for that change. Chief among them was the fact that we had a young family, and we really liked Gainesville, and we wanted to stay in Gainesville. And at that time, which was 1999 or so, I just didn't see myself staying at the University of Florida for a variety of reasons. And this opportunity arose in the private sector. So I kind of changed gears and decided to go in the private sector. And then after about 11 years, I got recruited back to university. And that's also quite a long story. But at that time, I think I accomplished many of the things I wanted to do in private practice. I was able to leverage a lot of the things I learned in the private sector community practice to benefit plastic surgery in the academic setting, and also to probably personally benefit myself. And I think I was situated in a much more significant way to improve academic plastic surgery, at least in this institution.
So when you came back into the academic world, can you kind of take us through your journey on how you became the chief?
Well, I got recruited back as chief. So it was they were looking for someone to kind of rebuild the entire plastic surgical program here in many ways. And I still had some friends here at the university who knew me from back then. And I stayed active in the university as a community physician. I would attend the journal club, so I wasn't a total stranger. They knew who I was. And I still did a lot of reconstructive surgery while in private practice, although I developed a pretty significant cosmetic surgical practice. And so I probably wouldn't have gone back as anything but a chief. And so it worked out well.
So going in both routes, sir, what would you say were some of the keys to your success that shaped your early career as you climbed the ranks in both the private and the academic sector?
Well, I think probably one of the earliest benefiting and significant events was having good mentors. So I had a bunch of really good mentors, and one of them was a pediatric surgeon, a guy named Thomas Crummell, who eventually became the chair of the surgery at Stanford. But he was my first research mentor. I entered his lab to become a pediatric surgeon, but his lab worked very closely with the plastic surgical lab because we were doing fetal wound healing, and the plastic surgical lab had a long-standing wound healing research lab. So that's how I got involved in plastic surgery. I had a spectacular mentor with a guy named Robert Diegelman, who's a scientist, a PhD, who really became a friend and a mentor and taught me a lot about science and working in the lab and scientific methods, et cetera. But the chief of plastic surgery at Medical College of Virginia, which is where I did my general surgery, was a guy named Kelman Cohn. And Kel took a real personal interest in my career, in me as a person. And that was really key in shaping how I would thought about my career and how I would move forward. Kind of stimulated me to do the best I can with everything I had, not to settle for anything but excellence. Always push the envelope to be the best you can and not settle, that type of thing. And then there were other general surgery mentors in that picture, but once I got into plastic surgery, there were some really significant people at the University of Pittsburgh that really helped shape me. And one of them was a guy named Bill Futrell, who was a longstanding chief of plastic surgery at Pittsburgh. And again, he was in many ways like a coach. He was the type of person who would never let you settle for anything but the very best you can do, would ride you really hard when he felt you weren't doing the best you could, and really helped get you to the next level in terms of being a good person, a good doctor, and always strive for excellence. And then there were several other faculty members within that group, such as Mike Bentz and several others that were just really, and Ken Shestak, that were just instrumental. Mike White, Fred Heckler, instrumental in just helping me shape myself as a best plastic surgeon I can be, and embracing the entire thought process, the innovation, the way to look at patients and tackle problems, et cetera.
Now, as your role the chief of the program, what advice do you have for the graduating chief residents and fellows entering the professional job market for the first time?
Well, I think that one of the biggest advice I can give is, remember, this is a business transaction, okay, and which is a little difficult for physicians in training. I mean, you're looking to find a position where you will be professionally satisfied, but also appropriately compensated. And that's an important thing, because people oftentimes afraid to ask about money, afraid of being offended. What I tell my residents is, if you're having a financial conversation, you're being reasonable, and the person you're talking to becomes unreasonable, then that tells you that's someone you don't want to work with. And so I think the biggest thing is to understand it's a business transaction, but it's also a relational transaction. It can't all be about money, but money definitely plays a role in that. You can't forget that. I think you have to look for people that are honest, that don't rely on a handshake, that are willing to put things in writing. I think you have to have a basis in reality and facts when asking for things, or looking for specific terms of employment. And same, the employer has to have those as well. I mean, if they want to pay you a certain amount of money or give you an incentive plan on something, it has to be based on something. It can't just be arbitrary. And I think the other thing is, if you're going into like the classic, solo, or you're joining a solo practitioner or a small group, there really has to be a discussion from the beginning about things such as partnership and ownership, and think about things not just about ownership of the practice, but if there's real estate and buildings and those types. I mean, kind of a broad answer, but you really have to look at it in a more broad business transaction rather than just give me a job and pay me. Now, there'll be positions like that, whether you work for a hospital system or a large employer, but even there still has to be discussions about expectations and finances, and you can't be afraid to talk about this.
So as we dealt with the pandemic in 2020 and still not kind of now in 2021, most annual conferences went virtual or online. And as we dealt with that, being a leader, what advice do you have for the graduating class regarding their networking and outreaching process in a virtual world?
Um, well, I think that the change to a virtual world was easier for the people that are residents now, generation, after me. So, and even for me, it wasn't that difficult. But so the virtual world has really changed a lot of what we do. It's really made it easy to connect with people around the country in different time zones. It's really been a huge time saver in terms of, you can do meetings back to back, for instance. You can do conferences back to back. But there's really no substitution for a personal interaction. So I think, if most things, I would assume that's going to happen over time, is that the beginning process for most interviews and most selection processes for employment or positions will occur through Zoom, and then that'll be the initial screening. After which, the in-person stuff happens. And I think the in-person stuff is absolutely important. You can't skip that. And if the group wants to skip that, you don't want to skip that. I think you really have to be in a room physically with the people you're going to work with, have a meal with them, talk with them, have a cup of coffee. I mean, it's a little different than the non-feeling nature of a Zoom conference. And then because you're going to be spending all that time with people, and it's not going to just be by Zoom. So I think Zoom is going to help us, but it's not a substitute.
So being the leader of a program, what are you looking for when medical students are applying for residency spots and also when residents are applying for fellowship spots?
I get that question a lot from the applicants, and I always give them the football analogy. I said, we all seen the running backs that don't make it in the next level because they get hit by the first defensive player at the line of scrimmage and stop. And then you can see the other guys who just kind of shake that tackle off or run through it and get another 5 yards. I want the guy who's going to take another 5 yards, or the gal who's going to take another 5 yards. I want them to be self-starters, take the initiative, run with the ball. I'm not here to hold people's hands. I think that the biggest problem with medical education is that it's so long. People are tracked in a almost, dependent student-like mentality when they just need to break out of that and be adults. And that sounds almost a little harsh, but when I say that to my residents, it almost frees them up to. I said, look, you're 30x years old. You should be telling me what you want to do, not asking me all the time. And then I'll correct you, and you'll feel much better about yourself at the end of the day. So I'm looking for people that are really have that drive, that self-confidence, but are also have great social skills and emotional intelligence.
Now, can you talk about your involvement with the American Society of Plastic Surgery?
Yeah, so I've been involved in many different ways with the ASPS for a long time. Currently, I'm the board vice president for academic affairs, which places under my umbrella most, if not all, the academic aspects of ASPS. So they include the advisory council. They include a little oversight on boot camp, oversight on the senior residence conference. There's multiple other committees I have oversight with, including the residence education committee and the resident education network with EdNet and all those type of things. It's a part of the executive committee, part of the board of trustees ASPS, and it's been a great experience. Before that, or currently, I'm actually also the chief medical editor for Plastic Surgery News. A lot of people ask, how do you get involved and move up an organization like that? And the key is getting involved early. And when I'll tell young folks in Washington that when ASPS sends out those emails asking for volunteers for committees, sign up for them. Look at the list of committees that you'd be interested in doing. Sign up. And the organizations are always looking for eager people who want to serve. And it's not like an all boys club or an all girls club. It's really as inclusive as it can get, and we really want people in there that are dedicated and want to serve. And and we don't know who they are until they volunteer. So feel free to talk to people to say, hey, I'm really interested in doing this. Can you get me involved? Write an email, apply to the sites when the applications open up, etc.
So now, as your career path has taken you to academic to private, back to academic, what is one takeaway that you would have given advice back to your younger self?
Well, that's a good question. That's a tough one. I'm thinking about that because I actually haven't gotten asked that question before. I think I would have, the advice I would be more patient. Okay, everything happens eventually. The way if you lay out a plan, it will come to fruition. Um, we do so much in a rush that sometimes we just need to take a step back, smell the roses. And I think, training is so long that and our work is so intense that if you really just don't sit back and enjoy the little things, and you miss them, and then you're really not getting fulfilled. So I think be patient and relax a little bit more, and enjoy the little things.
We hope you enjoyed this episode of Interview with the Surgeon. Until next time, stay focused and keep following your dreams.